Hi there. Today I want to talk a little bit about dovetailing EMDR, DBT, emotion regulation skills, and distress tolerance skills, along with internal family systems, and a little bit of somatic experiencing thrown in. I just wanted to share that EMDR is a very helpful therapy modality in helping people heal from recent traumas from 15 years ago, and also long ago childhood traumas. Those long ago childhood traumas, if you're an adult now, that takes a little more subtlety and an art of EMDR, let's say, because often parts, as you've heard me talk about with my internal family systems videos, the different parts get activated, and when they get activated, it makes reprocessing very much a challenge at times. That's not to say that we can still use some EMDR. It just needs to be a little more subtle and titrated a little bit. What I'd like to share with you is many moons ago, when I was starting out in therapy as a therapist, DBT was my go-to modality. DBT is a form of cognitive behavioral therapy. It's very effective in teaching people skills, how to regulate emotions, how to tolerate distressing times without making the moments worse, interpersonal effectiveness skills, and mindfulness skills. Those are a wonderful bunch of skill sets to have, and I still teach them and use them very frequently. What I noticed, though, is when someone is activated in their trauma mind and their nervous system, because as we understand now, trauma causes neurological changes, actual changes in the pathway of our neural networks in our brains. When those things happen and we get activated, the prefrontal cortex in our rational mind goes offline. So traditional talk therapy, and just use one of your skills. Often, if someone is activated into a dissociation or a heightened nervous system state, it's very difficult to access the prefrontal cortex and those skills. That's why EMDR is so helpful, and also some things that you can do, and one of the biggest ones is moving the body. Even when a part, if a dissociative part seems to be hijacking the whole system, if we practice, that part can learn how to get out of the state. So turning the head side to side, looking around, gazing, noticing colors, noticing shapes, noticing objects, people, animals, all those things that seem simple are actually ways to help the nervous system go from a state of I'm in danger or I'm frozen to coming back online. Another way to help our nervous systems, if we're getting either on the bottom of the ladder, the vagus nerve ladder, where we're shut down or avoidant or feeling depressed or activated and anxious, is to move the body. Bessel van der Kolk has written the book, The Body Keeps the Score. It's true. I know if I wake up feeling a little, not very excited about my day or worried about something, and I get outside and I go for a run, my mood just elevates. I have a better outlook about life and my day. I encourage you to be as active as you can, and that bilateral movement, whether it's pedaling, walking, jogging, paddling, dancing, anything that you're getting that repetitive back and forth is really, really good for our brains, because it does even out the blood flow between the hemispheres of the brain. Those are just some tips for today. Emotionally regulating is a neurological and a physical experience, not just a psychological problem. And we all have nervous systems that get activated or shut down or feel better. And our goal is to be able to experience all of those states when they're helpful and helping us to move forward, as opposed to keeping us stuck. Thank you for your attention.